Hi, everyone. I'm Maggie McGrath, editor of ForbesWomen. On Tuesday, massive job cuts hit the U.S. Health and Human Services Department, slashing thousands of jobs from the CDC, FDA, and NIH. Within these cuts, the CDC has eliminated its entire team focused on assisted reproductive technology. Joining us to explain what this means for fertility treatment around the country is Barbara Collura. She is the CEO of Resolve, the National Infertility Association. Barbara, thank you so much for joining us.
Thank you for having me.
So we're seeing reports of thousands of workers laid off from the Department of Health and Human Services. Many of those are within the CDC, and within that, there is this Office of Assisted Reproductive Technology. Broadly speaking, what does this mean?
Well, this is a group of 6 people. That's it. 6 people, but they were the team at the CDC, again, our nation's public health agency, that worked on infertility and in vitro fertilization, or IVF. In fact, their office was mandated by Congress in 1992. In other words, Congress passed a law that said CDC must collect this information on every IVF cycle, and they must report that to the public. So this office has been working under a congressional mandate for all of those years, and that entire team, again, only 6 people, have been let go. You mentioned thousands were let go. So you think about it, just this tiny, small group, yet they are the only ones at the CDC who worked on infertility and IVF. And 1 in 6 people globally are impacted by infertility. So that knowledge is now gone. It's walked out the door. There isn't anybody at the CDC who now works on or knows anything about infertility or IVF.
There's no one at the Center for Disease Control who knows about fertility and IVF. What about at the NIH, or does that not matter?
Well, I'm taking a deep breath because it's still hard for me. I've worked with these people for years. This is, a division within the CDC that is very, very important to us and our community. And so at the NIH, the institute that worked on infertility and also human reproduction is called the National Institute for Child Health and Human Development, or NICHD. I've learned that their director of the entire institute was let go yesterday, Dr. Diana Bianchi. But there are folks within NICHD that do research and also fund research on infertility. I have yet to learn their fate, but already I can tell you their ranks were very small.
You mentioned that a congressional mandate developed the assisted reproductive health team within the CDC. So are these cuts, especially of the 6 people that you mentioned, are those technically against the law?
I'm not a lawyer, but yes, I would say that that is the case. If Congress has said, you must do this, and you must do this every year, and you must collect this data, and you must report on this data, that's Congress mandating you to do something, which is, it's a law.
So you've talked about data, we've talked about research. Let's get into the nitty-gritty ramifications of these 6 people losing their jobs. What will be, I guess, let's look at the first 30 days, 60 days. What will be the immediate near-term impact of these jobs not existing?
It's a great question. And I would just say that, first of all, you've got a group of people that collect all this data from all of the clinics across the country. They contract out to a company to do all of the number crunching, and then they analyze that data. That's then put on the CDC website. So I've actually spoken to some of the team since they've been laid off. They're making the assumption that the contract has ended. Who's going to work with those folks? They don't know. There's nobody at CDC who knows that. So I think in the immediate, we probably won't feel something immediately, but all that data collection and all that work is going to stop. I think that probably means that, because they're always about a year behind. When you think about IVF, you're looking at what are the outcomes. We've got 9 months of pregnancy, etc. So these things are always about a year out. So I would say that we're probably going to not have the data from the last year that they've collected. That usually comes out at some point near the end of the year. We won't have that at all. And then one of the things that this group did is they took that data and they would produce research. And that research has really helped the field advance. So that's going to all stop. I don't know, quite honestly, who's going to be managing the content on the CDC website as it relates to infertility and IVF, because that was this particular group. So I will keep an eye on it and see if that data becomes stale and old. But certainly for patients who use this information, this was publicly available. It was meant for transparency. It was meant for patient access. And that is gone now.
Wow. So eventually we could have these websites that just are not up to date with the science. And I wonder, as we think about sources of research, data collection, information gathering, is there a private sector equivalent who could step in? I mean, these layoffs happened yesterday. So if it's a
Yes.
year, is there time for an institute on the private side to step in and pick up the baton?
Actually, there is. It's the Society for Assisted Reproductive Technology. It's the physicians, the clinics, and they collect data and they can fill this void. We've got to make sure patients know to go there. Going to the CDC is where everyone kind of goes when they get their public health information. So we've got to direct folks to that data now and that information. So I'm less concerned about some of that IVF success collection data. What I am concerned about is other ways that this particular group of people served as a resource within our federal government. A couple of examples that I know of. A couple of years ago, the Office of Personnel Management, which is kind of the HR department for federal employees, they wanted to add an IVF insurance benefit for federal employees. What did they do? They called this group at the CDC. They had them provide a briefing to them on infertility, on IVF, and all that information, as they should. It's government to government. It's within their own resources. We know that members of Congress get asked about infertility from their constituents, and they call this group at the CDC and they say, hey, I have a constituent who's asking me about what we're doing at the federal government about infertility. So they are a resource within the entire ecosystem of our federal government. And now that is gone.
That's one of the ramifications or downstream effects of these 6 people being fired. I wonder, what are the other, perhaps lesser recognized ramifications that could happen? I'm thinking about family planning information or programs, or what are the other things that we're losing sight of because we're looking at IVF and looking at the big headlines here?
Well, when you have a group of people that are experts on infertility and IVF within the CDC, within our government, they served kind of like they were constantly building bridges. So, for example, there is an STD group within CDC. Quite honestly, I don't know if they survived yesterday. There are some STDs that could cause infertility. They would work hand in hand on disseminating that information. What does the data show? Again, all of that evidence-based information. They worked very closely with the folks at NIH, the Office of Women's Health at HHS. So it's a small group of people overall, but they all worked really well together and provided an exchange of data and information to elevate the field. One of the things that I know they were working on was expanding access to IVF. They were looking at data from different states that had insurance mandates for IVF, looking at utilization, looking at outcomes, and then being able to put that research out there and say, actually having an IVF mandate is a very good thing. So they are doing a number of different things that now I don't know where that's going to come from. We're going to, as a community, we're going to have to figure that out.
Earlier this year, President Trump had referred to himself as the fertilization president. I'd love your reaction to that in light of the cuts that we saw yesterday.
Well, President Trump talked about IVF on the campaign trail. We were very surprised when he mentioned last year that he wanted to see IVF free. He said, I want everyone to be able to access IVF for free or your insurance pay for it. So he has really leaned in to expanding access to IVF. In fact, in February, he came out with an executive order that's asking his domestic policy council to come up with policy recommendations. I was thinking about this yesterday when I was talking to the folks at CDC that got laid off, and they said it and I said it. They are a resource for the president in order to fulfill these policy recommendations. They are a resource to the Secretary of HHS, to the White House. If we're going to lean all in on IVF, as President Trump has said, why get rid of the people closest to you who know the most? So I honestly, look, it was 10,000 or so people at HHS. This is 6 people. Maybe it was a mistake. Maybe no one knows that what they were doing at the White House. But I think we've just let some folks go that could be a valuable resource to the president as he wants to expand IVF. This is the group that can help him do that.
I was just about to ask, what is the chance that these cuts get undone and that these workers are invited back to their positions in the near term, or a month from now, 2 months from now?
I am raising the alarm that you've just let go the knowledge walked out the door that help you the most in doing exactly what you want to do with this executive order. So let's rethink this, because these are the folks that can really help you.
We've talked a lot about research, data collection, the importance of the partnership that this office provided within the federal government. But I have to ask, if anyone at home is watching and they themselves are in treatment for infertility, do these cuts mean anything for their current treatment?
Probably not. But if they're looking for credible, evidence-based information, there's a few sources, certainly. CDC is always a great source. The CDC also works with the World Health Organization and other health agencies around the globe. So it's an ecosystem that's constantly working to improve the patient experience and improve the outcomes. So in terms of people who are right now doing IVF, it's probably not going to be something that they're going to feel, but the care they're getting today is because of all this work and research. For example, used to be you did IVF and you got twins. Sometimes you got triplets. One of the things that the CDC is very, very proud of is because of this data and the work that they've done, we've been able to almost eliminate multiple births from IVF because doctors and patients are approaching it very differently. So we have better health outcomes for moms and for babies, and that's a good thing. So patients today are reaping the benefits of this group of people, whether they know it or not.
I think that's a really important point. Sometimes with public health, the benefits are not always obvious or immediately obvious to those who are benefiting. So in this case, again, there could be this long tail effect on what patients feel because of what happened yesterday. Now, I also want to ask, what does this mean for you and your organization? How does yesterday change what you're focusing on the day-to-day and what your 6 to 12-month plan looks like?
Well, we're an advocacy organization. We talk to members of Congress, we talk to decision makers, we talk to state lawmakers, because we are advocating for insurance coverage for IVF. We want to make sure IVF is protected. And we use data provided by I'm kind of laughing because it's kind of ridiculous to think about, but in order to influence policy, I use data from the federal government to make my arguments. So certainly over time, that's going to go out the window. I'm not sure that I'm able to use that data anymore. And that's really incredibly credible information. We always cited CDC data in our policy work. So I think from our perspective, this is a group that I personally worked with very closely. I know they were working for the best for patients and their outcomes. And I think for advocacy groups and people who want to advocate, not having the most comprehensive data and from our government is going to be a big gap.
Is there anything else you would like to share with our Forbes audience about the cuts to the team on assisted reproduction technology or infertility access in the U.S. right now as a whole?
You know, all of these cuts are hard. I'm sure every advocacy organization can stand here and talk about groups of people and departments. I'm seeing, you know, specific groups that have been let go. This is really unprecedented, and we've got to decide, you know, where we are as a nation. Certainly, what do we want our public health agency to be? And I think this is going to take a complete rethinking for all of us.
Barbara Collura, CEO of Resolve, the National Infertility Association, thank you so very much for your time and your insight today. We really appreciate it.
Thanks for covering this story.